Okay. Today I also got to speak to few of the gym owners,
Mm-hmm.
and I read a research paper which was with First Post, and they said that 22 minutes of exercise for
Mm-hmm.
a human body is sufficient.
Okay.
But these people actually train you for 1 hour to 1.5 hours, depending on your stamina. There is no categorization about how much time is required, how
Okay.
much for the exercise.
Mm-hmm.
So, what does a doctor say about this?
Okay. Actually, your question is basically what can be the sufficient exercise, right? For our human body, or how much
Also,
exercise we can
okay,
tolerate, right?
yeah, and also adding to that, Mayur, my question is also add the when you say somebody that exercise daily,
Okay.
what do you mean by exercise daily? What do you what does a doctor see as exercise? Because I am not necessarily assuming that when you say exercise daily, you ask your you ask the patient to join a gym.
Mm-hmm.
So what is the definition of exercise for a doctor?
Okay. 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 See, if you go to any doctor and ask them about how much exercise should I do or how much exercise is sufficient for my body, if you ask to any doctor, then every
Hmm.
doctor will suggest you the combination of two things basically,
Hmm.
and that is to remain fit and to remain healthy. Okay. The combination of
Okay.
two things. The one thing is the doctor will suggest you the moderate intensity aerobic activity for one around
Hmm.
150 minutes per week. Means that is around 30 minutes for 5 days. Any moderate
Okay.
intensity aerobic activity, which can be like swimming, cycling, dancing, walking, anything
Hmm.
that gets your heart beating at faster count. Okay, so this is the one
Hmm.
thing. And the second thing, the doctor will
Hmm.
suggest you that do some moderate to intense muscle strengthening activity. Okay, for 2 days a week.
Hmm. Hmm.
So every doctor will suggest you these two things. Actually, these things are
Hmm.
in medical books also. So
Hmm.
basically, there is no any term like sufficient exercise. Actually, the term sufficient is itself a relative term. I mean, sufficient exercise for one individual may not be sufficient for another individual. Okay, just for example,
Hmm.
what is sufficient for me may not be sufficient for you,
Hmm.
right?
Hmm.
So we
Hmm.
can't classify it like that. It actually depends on many
Hmm.
other factors like age of the patient, sex of the patient, overall body build of
Hmm.
the patient. And the most important
Hmm.
thing that you mentioned, what doctors suggest regarding the exercise, the most important thing, the purpose of
Hmm.
doing the exercise. Because see,
Hmm.
many people do exercise for various reasons. Few people do it for
Hmm.
just to remain fit or just for to remain healthy. Few people do it for
Hmm.
some recreational purpose. Okay, or few
Hmm.
people do it
Hmm.
for better appearance. Okay, to curve their to shape their body in curves, or
Hmm.
for better appearance, like that, to lose weight or to gain weight. Few people do it for the
Hmm.
competition, like bodybuilders. So actually, the
Hmm.
sufficiency, it depends on the purpose also. Are you getting my point?
Hmm.
It varies
Yeah.
depending on the purpose for which you are doing exercise, right?
Hmm.
So
Hmm.
we consider all these factors while starting exercise or while starting gymming or while starting anything. We consider all these
Hmm.
factors. But one most important
Hmm.
factor that we usually ignore or we usually neglect,
Hmm.
and that is our
Hmm.
cardiovascular health. And actually, that is the
Hmm.
main reason for rising number of deaths in younger generation, because they
Hmm.
don't look after that their cardiovascular health. Okay,
Hmm.
means
Hmm.
actually it simply means how much exercise is safe for our body rather than sufficient. How much exercise is safe for our body? This is very much
Hmm.
important. How much exercise our body can tolerate? We never ask
Hmm.
this question to our body. We only see the
Hmm.
purpose for what we are doing it, but we never ask our body this question: how much exercise we can tolerate, right? So I think all these
Hmm.
factors decide how much exercise will be sufficient and will be safe. And it varies from person to person. So it's actually a
Hmm.
completely a relative term. We can't classify it for every individual. Okay.
Okay. Okay. So that brings me to another question.
Mm-hmm.
You were talking about the cardiovascular strength.
Hmm.
What has, I might sound very generic, but
Hmm.
what has my heart to do with exercise? I
What?
understand the pumping blood and all, but explain me as a layman. How is my heart related to the exercise?
How heart is?
How is my heart
Hmm.
is affected, impacted, whatever it is, by the kind of exercise that I do?
Okay.
What happens?
See, while
What
doing,
happens to the pumping of the blood? What
yeah, yeah,
happens
yeah,
to my heart rate?
yeah, yeah,
How is it
I
associated?
got your question.
Hmm.
See, while
Hmm.
doing the exercise, the requirement of blood supply for various organs, for muscles, for all the muscles of our body is increasing. So our heart has to pump extra blood to those
Hmm.
muscles, to supply them that extra
Hmm.
demand. All the muscles require extra oxygen while doing the exercise. So oxygen will come from
Hmm.
blood, and blood came from
Hmm.
heart. So heart
Hmm.
has to pump that extra blood. So the pumping capacity of the heart is increased
Hmm.
during the exercise, right? And if your
Hmm.
heart is not capable enough to pump that enough quantity of blood, then your heart will
Hmm.
start paining, or your heart will start
Hmm.
getting fatigue, right? And that's where the
Hmm.
you get the heart pain, you get the chest pain like that. So that is
Hmm.
the basic phenomenon behind that.
Okay. So, if I am not doing any exercise,
Hmm.
my heart is at rest. It is doing its daily job, whatever it wants to do. Whatever, how much of blood it wants, it feels that, okay, this much is required, it would pump it. Why would I want to strain my heart by exercising? What do I get out of it? Is it a good thing or a bad thing?
Actually, we have to prepare our heart for the situation where we demand, where our body require extra amount of blood. So we have to prepare our heart, because many times we climb the stairs, we in the metro stations, yeah, anywhere. When we when our body require more amount of blood, that time our heart should be prepared for that. So for that, we have to
Okay.
prepare our heart, because we are witnessing such a cases not only during exercise, not only during gym sessions. We are witnessing these cases
Hmm.
in the on the grounds. The kids are also
Hmm.
collapsing. We are witnessing many incidents in public places, right? So we have to prepare
Hmm.
our heart for that. So that's why exercise is essential. Exercise is required.
Okay.
Mhm.
So, it relates to the kind of lifestyle that today we have. There is
Mhm.
not much more pressure put on heart, and that increases the chances of cardiac
Right,
arrest
right, right.
among.
Our
Okay.
lifestyle is completely changed. We are like our lifestyle is now becomes more like sedentary lifestyle, right? Our
Hmm.
dietary
Yes.
patterns are also changed. So all these things actually impact,
Hmm.
right? People are not aware about it, but there are two things. The one thing is
Hmm.
cardiac arrest,
Hmm.
and the second thing is heart attacks. These two things are
Okay.
completely different, actually. Okay.
Okay.
Uh,
Hmm. Thank you. Okay.
Hello.
Yeah, yeah, yeah. Thank you so much for this information. Yeah. How are they different?
Actually, the cardiac arrest can happen to anyone. Anyone must mean
Okay.
it can happen to any kid, it can happen to young individual, it can happen to old individual. There is no any such a
Hmm.
criteria. While the heart attacks
Hmm.
are usually common about the age of 30, 35, 40, and the mechanism for both these things are also different. The heart attacks can happen because of blockages in our coronary arteries, so that our heart will not get enough blood, so that heart will not work, and that's why we get the heart attack. Our dietary patterns, our lifestyle, all these things are
Hmm.
responsible for heart attacks. But in the case of cardiac arrest, there is
Okay.
nothing like that. It can happen to anyone. The mechanism for it, it's maybe because of unknown reasons, maybe because of unknown cause. So it's not like that. Maybe because of many congenital heart diseases are there, which remain undetected, and suddenly the cardiac arrest happen. But for in case of heart attack, our daily lifestyle, our
Hmm.
dietary patterns, yeah,
Hmm.
so all these factors responsible for heart attacks.
Okay. Fine.
Hmm.
My next question would be, when we today interview people who are at the gym, and when you ask them what is your goal, the men have this six pack abs kind of thing going on. That
Right.
everybody wants thinks that if you have a six pack abs and a tricep and a bicep, you're the most fit man on the earth. And for women, it is just to look like slimmer, thinner, skinnier. That's the thing. The basic understanding of being internally fit and externally fit,
Mm-hmm.
that awareness isn't there among people.
Mm-hmm.
And that leads to everybody believing whatever their gym trainers say them.
Mm-hmm.
And nobody inquires if the gym trainer has the authority or the capacity, or if he is educated enough to pass on the information that he is imparting.
Mm-hmm.
And gym, it has become a fashion. It's a fashion thing. It's more like a show-off thing. It is not about most of the people getting into gym are not there to look fit. They just want, it's part of habit to get more muscular body, to look more attractive.
Right.
Do you think, is that the reason that people also go for steroids? Because that helps you, I think it is easier for you to get into shape. Like the muscles are more visible, or it helps you shed away weight like in a lesser time.
Mm-hmm.
Does that impact human body?
Yes, to some extent, I think yes, because the trend of all these things is going on in the youth actually in today's generation. But I think, see, nothing can be absolutely good or nothing can be absolutely bad, and actually it suits to this gymming fashion also, right? It always lies somewhere in between the extremes. Actually, in all these cases, the role of gym instructor is very crucial in all these things, because see, doctor is not going to monitor you all the time. Doctors can only certify you whether you are fit or not, doing some kind of intense physical activity or playing an intense sport. Doctor can just advise you, doctor can just certify you, but at the end the gym trainers are the one who decide your daily workout limits, right? So they should be professional, they should be professionally trained in all these aspects. But actually, unfortunately, what is happening around, if you visit any gym, you will realize that in most of the gyms, the gym owners usually hire the trainers which are mostly unprofessionals, or with kind of half knowledge like that. And because the reason is also simple, because the gym owners also can't afford the high charges to pay them. So, and it's very common in tier 2 and tier 3 cities like that, and also in small towns also. So this is very serious concern. Actually, gym trainers are not very well knowledgeable, so that they can advise properly, and they just run their business for their own interest. And the one more issue that you have highlighted, that the muscle building substances, right, like various protein powders, supplements, which are provided by these gym trainers. Actually, all these products have definitely have certain side effects on our body if you take them in excess. If you take them in excess, see, anything in excess is a poison. We all know that. So these products, these protein products or some other supplements, they are also not exception to this, right? They can lead to morbidity, like many cases. Many cases of kidney failure have kidney failure just because of taking extra amount of protein powders and all that have been detected in last few years. So they can lead to the morbidity or even mortality in any individual if you take them in excess. So actually this is a very senior concern, and you rightly said that many gyms have become business hubs right now, which are they are actually running like franchises of different brands. They just do the marketing of various products and all that, and sell those products to the people who are coming to their gym. So they are only taking care of their own interest. They don't think about what actually people need. They just run their businesses. And see, the doctors have to study for minimum 5 to 6 years to become a registered medical practitioner and to prescribe medicine to the patient. And these people prescribe such a supplementary products without any proper and in-depth knowledge regarding that. So I think it's not right thing, na? And I just want to share one my experience also. I have seen few of my close friends who are running similar businesses along with their gyms also. Same kind of business, that is branding of various products, various supplements. Actually, it's unfortunate that I have seen that many times even they don't know the contents or composition of such a protein powders or supplement products, but still they sell those products to their gym members without considering the physique of the individual. So, and many times all these people claim that they are certified people for selling these products, but I don't know how many actually. Some people are genuine, no issue in no. I'm not against them. Some people are genuine, some people are knowledgeable, they are professional, but I don't know how many of them are actually certified through proper channels, and how many of them just got it through some other ways, illegal ways. So I think all these things require some strict regulation, because it's issue of the kind of public interest, right? It's related of public health. So all these things need to be regularized.
Okay. So my initial research says that if I want to open a gym, so I need to register it under the Partnership Act of 1935, and I can do that. Okay.
Which act?
Now, as Indian Partnership Act, something like that. Okay. It's a 1935 Act which I read upon. Okay. So just as a firm, if I want to set up a firm, so it's not like I don't need any clinical certificate. Okay. It's just like a business firm. If I and you want to set up another business, maybe a franchise about selling clothes, it's the same. It's the same for setting up a gym too. Okay, it comes under the Partnership Act. Okay.
Okay.
And second point is, the gym trainers do need certification. And most of the time, at least in Chennai, they actually go through a 1-year PD diploma program.
Okay.
Where they are taught about what kind of nutrition you give, what kind of food you are going to tell your client to have. Okay, that's there. But there is also a problem that how many gym instructors, it can be the case in Chennai. Okay, but I don't believe that a gym operating in a small third-tier city,
right,
the guy who has opened it would have that certification, because there is no regulation to go and check upon these gyms.
Right.
Most of the raid that happens on the gym is when a policeman would find out, okay, they're selling some wine, alcohol, or something like or they are under the shade of running the gym. There's some sex extortion going on. Then these places come into news. But there has never been a raid about finding out if the people running these gyms have the required degree or certificate.
Right. That's what I'm trying to say actually. How many of them actually certified through proper channels? Actually, that's the issue.
Yes, okay.
Because it actually ultimately impact the health of the people now. So it should be regularized.
Yeah.
I think there should be some regulatory authority, and there should be strict regulations for that. Even for a wrestling federation, wrestling criteria, there is a wrestling federation which was in news in last few months. So I think for gym trainers also there should be some regulating authority. That's what I think.
There isn't the regulating authority, but yeah, they kind of need a certification. They do need. But But there is no authority to check if they have it.
Right.
So, what else I wanted to ask you was, gym more likely I told you, it's a fashion thing.
Yeah.
Like it's a celebrity thing.
Yeah, right.
Okay. So, what precautions should an individual take when he enrolls into a gym? What all things as a doctor you would prescribe before anybody goes on to taking a membership for a gym?
Actually, before explaining that, I just want to explain one more thing, that in precautionary measures, what we can do in general. We can prevent such a sudden incidents of cardiac arrest or heart attack by doing one thing which is in our control actually. See, our age is not in our control, our sex is not also in our hands, or any hereditary factor that we carry from our parents, that is also not in our hand, right? We can't control them. But our daily lifestyle, our dietary patterns, our habits, day-to-day stress management, or what we can say, proper sleep, all these things are in our hands. So we can take care of them, we can control them, we can manage them properly at our individual level. Hello? Am I audible?
Yeah.
Then comes the next step actually. See, as a doctor, I personally feel that to avoid such incidents of cardiac arrest or heart attack during the exercise or during post-exercise period, what I think is
every individual must go through some screening of his or her cardiac functions before starting any kind of such an intensive physical activity after a long period of time. Means before joining the gym, or before starting exercise after a long period, or before joining any even dance class, even before involving into any intense sport activity. I think the basic screening should be done because it's very much essential. Actually, for this basic screening, we usually call it as a pre-participation medical evaluation. It is essential for actually sport persons, but I think it should be done by every individual before starting any physical activity, any intense
What did you
physical
say
activity.
it is? Pre-participation?
Pre-participation medical evaluation.
Okay.
Basically, it includes ECG, then echo, and stress test. These three tests. ECG, echo, and stress test. And I think along with these screening tests, every individual should test for the periodic blood sugar monitoring, or blood sugar level, blood cholesterol level. All these things should be monitored periodically. All these things are also essential. So this thing we can do. Then I think at community level, or with regard to awareness, I think few things we can do that. People, including our friends, family, relatives, or even bystanders who are at scene witnessing somebody is going through sudden cardiac arrest, they have also crucial role to play in those instances. If they know a life-saving skills called cardiopulmonary resuscitation or CPR, then they can promptly act to save the life of that patient, right, till other medical help comes. So that period is very crucial actually. That in case of heart attacks, we get around 30 minutes to 1 hour of that golden period. In case of sudden cardiac arrest, we hardly get 2-3 minutes to react and to respond. Hardly 2-3 minutes. In 2-3 minutes, heart literally stops to pump and the person dies right away. In case of cardiac arrest. In case of heart attack, we get around 30 minutes to 1 hour, that golden periods. In that we can respond, we can react, we can treat that patient, right? So the role of the people around that patient is also very crucial. And I just want to give you one example. In Western countries, there is one ideal model of they have installed automated external defibrillator in public domain. At various public places, at airports, at railway stations, at public places.
Hello. Oh, not again.
You'll be surprised that the survival rate of the patient.
Mayur, I lost, I think 20 seconds of the conversation. I couldn't hear you. After what you said, in Western countries, there's this install automated something.
Yeah. There is one model. They have installed automated external defibrillator, AED.
Okay.
At public places like airports or railway stations or any metro stations, at public places in general. And actually, they have also trained their people to use it. So it actually drastically reduced the death rates among the patients with sudden cardiac arrest, because the patient with sudden cardiac arrest, they require immediate treatment. They require treatment within 2, 3, or 5 minutes. So they have installed that, and it drastically reduced the death rate among the patients. In India, the survival rate of the patients who are suffering from sudden cardiac arrest is just 1 to 2%. Just 1 to 2%. Means out of 100 patients, if 100 patients got the sudden cardiac arrest, just 1 to 2 patients survives in India. In Western countries, survival rate is around 60 to 70%. Just because of all these advanced emergency medical care.
Okay.
And in India, the people are also not aware how to give CPR, how to give basic CPR, how to use all these AEDs and all that. So I think awareness among the people is also very much essential, very much required. I think that's what I think we can do. So all these are the ways through which we can reduce the burden of such incidents.
Okay. So that brings me to the last question. So all like basic elementary education that we provided in school, it talked about something called balanced diet. But today the emphasis is more on protein. Everywhere it's about protein, how much intake of protein, you have protein powders, even the gym people. The only the only thing that they talk about is protein. There's no conversation about carbs, whereas carbs is believed to be the energy giver.
Right.
So do you think that also leads to, in a way of, that adds to kind of overdose of protein or something, like too much emphasis on protein and not on a balanced diet? And also, I would want to know how effective is the concept of balanced diet from a doctor's perspective, and how do you see these lot of emphasis on protein? How does that lead to, like, does that have an impact on human, like your heart, or does that lead to death? Can that lead to death?
Yes, definitely. To some extent, it may be the reason, because the balanced diet it simply means there should be the balance of everything. The protein should be around 25%, the fat should be around 10%, the fiber-rich diet, fruits and vegetables, all these things should be there in our diet. But if we take only proteins, then it will definitely affect our body. As I said, everything in excess is a poison. So it will definitely going to impact our body and our overall physique of our body. So yes, it definitely impacts on our health.
Okay, that makes much more sense to me. Okay. Okay, now please enjoy your whatever food you've ordered. Thank you so much for your time. It was great, very insightful.
Yeah, thank you. And if you want any details regarding any data, then also just ask me. I will go through some research paper and then I will provide you if you want anything, okay?
Listen, the data chart would add. Don't write what? Don't just write what you're saying. Right, okay, makes sense. The data chart would add much more value to my story. If you can come up with data and give it to me, I would be much more thankful to you if you could do that. Just take out like half an hour of your time. Tell me what data to look for. I would do that.
Okay. Okay.
Okay.
And I will forward you. Okay.
Okay. Thank you so much. Thank you. It was very insightful talking to you. Thank you so much.
Okay. Thank you.